is a new well-being clinic in New Haven for people with cardiovascular conditions, what to know about mental health and heart care, how patients can benefit, and the ways this clinic can also help out other doctors. Joining us this morning, Dr. Kim Smolderin, professor at Yale School of Medicine and a founder of the new Yale Medicine Heart and Vascular Psychology and Wellbeing Clinic. Doctor, thank you so much for being with us this Monday morning. Let me start right here. How does mental health really impact somebody with cardiovascular disease?
Good morning, and thank you for having me on. When people hear the diagnosis of a heart condition or have recently gone through a cardiac event, it makes people pause. And as we all do, we want to live long and healthy lives that are with high quality of life. And so, this point of the heart condition is when many questions come up. And also, what people might notice is that feelings of depression and anxiety may come up. And that is a moment where they are ready to ask questions about how to live their life going forward with this new reality to the fullest extent as possible, and maybe address some anxieties or limiting beliefs that they had before the heart condition.
Doctor, I can really relate to this because I am a cardiac patient. I know that when I got my initial diagnosis, how traumatizing it was in the beginning and getting kind of over that hump to deal with it effectively. And with that in mind, what kind of services are provided to patients at this brand new clinic?
Yeah, you put it really well. It can be experienced as a traumatic experience. A lot of uncertainties come up. And if people have prior trauma or anxiety, they might benefit from treatments such as cognitive behavioral therapy, or what we also offer is EMDR, which is a newer intervention based on insights that we gathered on how to treat trauma, and that is eye movement desensitization, reprocessing therapy. And we teach them also coping skills on how to reduce stress and mindfulness-based practices. So that's just a sampling of the type of
Right.
intervention we offer.
Doctor, also I mentioned in the intro that this clinic is also helping out other medical professionals. How is that happening?
Yeah, I think a lot of the time of the encounter with the cardiologist is spent exactly on talking about people's insecurities and anxieties. What activities can they be engaged in? How can I redesign my life so that I have optimal heart health going forward? And some of these questions, maybe the doctors don't have always time to address all of them, and we can further work on them in the psychology clinic. And then the other reason I would say is it destigmatizes the topic of mental health. Mind and body are one. And yeah, I think it really highlights that the whole spectrum of functioning is important as we strive to improve our cardiovascular health. So those 2 points, I would say, contribute to the benefit of the doctors as well.
Okay, doctor, real quickly, do all post-cardio patients at Yale go to this clinic? Is this kind of standard course of action now?
So it works by getting a referral by the cardiologist. So if he or she thinks they would benefit from this service, and it's always in consultation with the patient, of course. The patient may request it also to their cardiologist, but that's the way to get in. So if you're actively seeing a cardiologist within the Heart and Vascular Center at Yale, you might want to ask your cardiologist.
All right. Dr. Smolderin, thank you very much and good luck with that new clinic.
Thank
We
you. Thank
appreciate
you.
you.